Olá, bom dia ou boa tarde para quem nos
Hello,
assiste.
good morning or good afternoon for who's watching us, because today we have lots of people all over the world. I am Guta Nascimento, I'm a journalist, and it's always very gratifying to participate in the activities from the Lado pela Vida Institute. This is the third time that I am the moderator talking about the valve heart diseases, also known as valvulopathies. Last year, we were together in the launching of the guide document called Valvulopathies and the Future of the New Generations. And today, we are going to show you something that has never been seen before about awareness and beliefs about valve heart diseases in 4 countries in Latin America. This was done in Argentina, in Colombia, in Brazil, and in Mexico. We are going to be here for 90 minutes, and we're going to separate our program into two. So first of all, we're going to hear Fernanda de Carvalho, from Instituto Lado pela Vida, and she's the representative at the Global Heart Hub dedicated to valvulopathies and atherosclerosis and cardiomyopathy and heart failure. And then we're going to have the presentation of the research by Roberta Pimenta, who has a PhD in marketing and finance and administration, business administration in Brazil and in France. Roberta is specialized in planning, executing, and analyzing qualitative and quantitative research in different areas. And then in the second part of our event, we're going to hear our 3 guests. We have 3 very special guests who are going to talk about their perceptions about the findings in this research. So now introducing the study so you can understand the dynamics. For those who are watching us, we have Dr. Auristela Ramos. She is a cardiologist and head of valvulopathies from the Pacientes Institute. And this is a hospital that is associated to the Secretariat of Health of São Paulo. And once again, we have Dr. Auristela, who was with us last year. She was here when we launched the guide, and she studied at the University of Pernambuco. She's a cardiologist and a specialist from the University of Pernambuco and also Dante Pazanese. She also has a fantastic curriculum. She was a fellow in the University of North Carolina, and she has also worked in the University of São Paulo. And since April, Dr. Auristela is a member of the scientific committee of the Lado pela Vida Institute. So it's a pleasure to have you, Dr. Auristela, with us and to be able to very happy to announce your association to the committee in Lado pela Vida Institute. And remotely from Mexico, we have a dear friend and partner, Dr. Carlos Castro. And he has a bachelor, so he is a president of PACO, and it's an organization dedicated to increase the awareness about the impact of cardiovascular diseases in health. Dr. Carlos, thank you very much. Muchas gracias for being with us. Carlos also does some very important work in Mexico after the death of Alejandro, his nephew, together with his wife and daughter and son-in-law. They talked about PACO, which is about donation of organs. And this is to help the population in Mexico that doesn't have any health care, and this helps in the transplantation of organs. Carlos is an active influencer in terms of cardiovascular disease and talking about the coverage of health in Mexico. So it's always a pleasure to have him here at the events from Lado pela Vida Institute. And then from Ireland, we have Neil Johnson, who is a great person that really supports the activities of Lado pela Vida. He is the executive director of the Cree Heart and Stroke Charity and the Irish National Institute for Prevention and Cardiovascular Health. Neil is one of the founders and the executive director of the Global Heart Hub, which is an international alliance of organizations of patients. And the objective is to give voice to the people who live with or are affected by cardiovascular diseases. And there's Lado pela Vida Institute and Baco as affiliated members. Neil has over 30 years of experience in leadership, management, and development of the third sector in cardiovascular health, working in the development of services, prevention, rehabilitation, education, and training, research, engagement, and defense of the patients. So I'm very happy to ask Fernanda de Carvalho, who's here with us, to start our program. Thank you very much, Guta. It's always a pleasure, and it's great to have you with us with your energy and your engagement in everything we do. And Roberta, I am very anxious to listen to your presentation. And once again, it was a great experience to have you coordinating another project of the Instituto Lado pela Vida Institute Research Nucleus. And Dr. Auristela, as Guta said, it's great to have you here at the studio. And knowing about your intense agenda with patients and in your research as well. And today, probably here with Lado pela Vida Institute and Marlene Oliveira, our president, we'd like to thank you for accepting the invitation to be part of our committee. And talking about Marlene, she asked me to tell all of you that she's very sorry not to be here today, but it's exactly now that she has an agenda in Brasília, our federal capital. Everybody knows that she is an active voice for cardiovascular and oncological patients, always working to really change healthcare in Brazil. And Neil and Carlos, we give you special thanks for having supported this project and the research that was done in Latin America for us to be able to understand how much the population of these four countries know or don't know about the causes and the impact of valvulopathies in people's lives. The main objective of this study was to collect subsidy for our activities. Three organizations, the three of us, right? These three organizations that we represent are extremely experienced and recognized for developing awareness campaigns and projects dedicated to the patients and their family members. And also in terms of dissemination of quality information for laymen, warning them about the importance of taking care of their hearts, because cardiovascular diseases are the ones that kill the most around the world. The data from the survey will be very valuable for the production of content in our communication channels, and also to give us a basis for our advocacy actions and to influence public policies positively when we talk about cardiovascular health. So before the presentation by Roberta, everybody's very curious to hear about it. We would like to show you a video that briefly summarizes the scenario of valvulopathies here in Brazil. Can we have the video, please? Valvulopathies are the diseases that get the heart, one or four of the valves. And countries, rheumatic fever is the main cause of valvulopathies. We also have an aging Brazil. In 2030, it will be the fifth country with older people in the world. And these are the needs of Brazilian patients. Cardiovascular diseases are the ones that kill the most in the world. And to reduce this scenario, we have to act on who manages public policies, the patients, family members, and caregivers. We have to pay attention to what science and technology offer and have a virtuous cycle in healthcare. The population needs to take on its responsibility. Stop pointing fingers and understand how healthcare services work in Brazil. trying to find the best for people who need it. So side by side or lado a lado, we're going to look at the needs of a continental country with inequalities and challenges, and only together will we be able to have patient in the center of healthcare.
Lindo vídeo. Eu
Oh.
sempre reforço, né, Fernanda? Eu sou suspeita,
I
mas eu tenho uma profunda admiração pelo
I really
trabalho que vocês do
admire the
Lado
work
fazem
that
na
you do at
comunicação.
Lado Lado in terms of
Esse
communication.
vídeo traz os
And this
elementos que
video
vocês sempre
brings the
trazem, que é
elements
uma
that you
linguagem
always
muito
bring.
acessível,
So it's
reforçando
accessible
alguns pontos
language,
que são muito
reinforcing a
importantes.
few points that are
E
very
chama muita
important.
atenção
And
nesse vídeo
what really
quando
calls my
vocês fazem
attention is
essa
when you
colocação de que cabe a todos nós.
say, you know, something that has to do with everyone. So all of us have to contribute towards this general healthcare in Brazil. So, you know, how can we as citizens and people who don't work with healthcare, how can we help? So we can do something that we do a lot, which is share. So if you're watching this event, if you know, and if you have family members or you live with people like that, or people who deal with this sort of topic, you can contribute towards the dissemination of the information. And the more information we have, the more we're going to be able to work on prevention. And we're also going to become more aware as citizens about how we can contribute towards public policies, healthcare policies. And I would like to ask everybody to share this video that is available on YouTube, and you can write to Lado Institute. They have a fantastic communication team, and help this message get to more people. But let's go. So, Roberta, over to you now. We would like to see the numbers. Please share the numbers of the research. Yes, let's go. So the idea has always been, well, first of all, thank you very much. It's another collaboration with the Lado pela Vida Institute with the intention of providing unseen information about what is circulating around Brazil in terms of information in healthcare. So this is research with laymen to evaluate what their level of knowledge is, what their level of concern is between between people, non-experts in the medical area, and talking about cardiopathies and valvulopathies, the valve diseases of the heart. So we went to ask Brazilians, Mexicans, Argentinians, and Colombians through a panel. The panel is a structured group of people who are not prepared, but they are willing to answer research. So we used OfferWise that opens or gives access to 10 million people in 20 countries doing or opening up this possibility of consulting them. So this is about different subjects. So we did, oops. Okay, now it's working. So we made a good distribution of these sample of participants. So it was 2,821 people, about 900 in Brazil, another 900 in Mexico, 500 from Argentina, and 500 from Colombia. They were distributed between different age groups and very balanced. The research happened in the middle of April of this year, and it was half and half, boys and girls, and about 38 years of age, so male and female. And we also wanted to know how these young people behave and people who have are in a higher age group. So who are these people in terms of access to healthcare? So we asked them, and we discovered that a little over half of the sample, of the total sample of 2,800 people, more or less, they use the public healthcare services in these four countries. In Brazil, the index is a little higher at 68%. So this is the composition of the sample. And this is, we're going to see how this works out. Well, so let's begin with a question that I think everybody thinks about, which is, what kind of diseases worry you? And cancer is number one in the list with 62% of the answers. Yes. So they're worried about cancer in their personal lives, but the cardiopathies come in second place, very close and also very important. So cardiac diseases, they concern people as well. But we're talking about valvulopathies here. So what kind of knowledge do people have in Latin America about valvulopathies? Well, okay, so heart diseases and the valve diseases, not specifically. 30% is reasonable, but it's much less specific compared to the heart in general. And valvulopathies have less, they are less concerned about valvulopathies in Latin America compared to Alzheimer's. They're almost the same here. But I think that I would expect a little bit more, but this was the response that we got. Valvulopathies are still not well known and not present in people's awareness in Latin America specifically. And how does this, how is this designed, or how is this going to be developed? So before that, we also asked them a very interesting question, and I think it reinforces the information from before. So when do you run to the doctor? What needs to happen for you to run to the doctor? And then we discovered that symptoms that have to do with the heart, so chest pain, palpitations, tachycardia, bradycardia. So this leads people to the Latin Americans to the doctor, and in 90 or 80% of the cases. So in other words, if we're at the top of the memory, top of mind, right? If cardiopathies are the main thing, the cardiac symptoms also take them to the doctor, right? So let's take a look. Let's see what's happening. If we open up according to the country, so Brazil, Mexico, Argentina, Colombia, all the countries, they do the same. So it's tachycardia or bradycardia or chest pain. That means you have to go to the doctor. Let's go to the doctor. And in the same question, there's also something that came out that was interesting. In all the countries, except in Brazil, aging is not a reason to go to the doctor. It's not for most people, right? It's a small number, like 1/4. So aging for Latin Americans is a concern, So let's take care of our aging. In Brazil, not so much. And then what about your throat, a sore throat? Why sore throat? Because that is a possible cause of a valvulopathy, but that does not mobilize all Latin Americans. About 40%, 50%, they go to the doctor if they have a sore throat. The Mexicans and Brazilians, they are more concerned compared to the Argentinians and Colombians. Let's see the sore throat at the doctor. And another interesting thing, Brazil mobilizes to go to the doctor more than in other countries in the case of symptoms that affect well-being and vitality. So if I feel older than my age, if I feel I have some incapacity, so that's how we propose the question. If you feel older than your age, it could be several symptoms, it could be several reasons. Brazilians, they are more aware of that. They're more worried about that compared to other Latin Americans to go to the doctor, to see what's happening. Fatigue as well mobilizes Brazilians more to go to the doctor to understand what's happening. And there's also difficulty, everything that has to do with vitality. So, difficulty in doing your daily activities, that also takes Brazilians, 2/3 of Brazilians, to the doctor and to understand what is happening. Going to the doctor due to fatigue is a habit, or maybe a concern, a greater concern amongst people who are above 60 years of age compared to those who are below 60 years of age. There's a slight difference, important difference. So 67% of those who participated in the research out of the total in the 4 countries, they said fatigue, I think it's better to go to the doctor if they are above 60 years of age. With less than 60 years of age, it goes down a little, and it's a little over half of these Latin Americans. So we are following up the habit and what kind of care that Latin Americans take in their health. So we discovered a little bit about the habits of monitoring health. But let's go straight into valvulopathies now. So valvulopathy has, as one of its causes, pharyngitis, so streptococcal pharyngitis or sore throat caused by bacteria. And we observed that in Brazil, we asked the participants, so did they have a sore throat when they were children or when they were teenagers? 2/3 of people in Brazil say yes. Of course, this is a report coming from these people. And in Mexico and Colombia, there was a smaller number, but it's still 1/3. So what happened at this moment of the infection in the past? So how did that happen? What happened? What kind of infection was it in the throat, in your throat? So 2/3 of the participants say that it was recurrent. So most of them, at least in Brazil, said that this was a recurrent symptom in childhood or when they were teenagers. And what was it like, or how was it treated with antibiotics? So most of them said that they used antibiotics, injectable or oral antibiotics. So that's important because, once again, infection in the throat due to bacteria, it is one of the possible causes of valvulopathies. And carrying on, this is a part of the research that is very useful in the campaigns. How much do people really know about valvulopathies? The question is, do you know what it is? Do you know what a valvulopathy is? Half of the participants, at least, said, yes, I've heard of it, but I don't really know what it is. And we have this index, which is a little higher for people who report some kind of cardiopathy. So they pay more attention to what a valvulopathy is because they are patients that have cardiopathies. So if the question is made to Latin Americans that are above 60 years of age, they know a little bit more about valvulopathies compared to people below this age group. And then we challenge the layman's knowledge. So we wanted to know from the Latin American population what kind of knowledge they had of the symptoms. We talked about the symptoms and causes and consequences. We talked about treatment. So what are the symptoms? So symptoms for laymen, most of them Most of them believe that in valvulopathies you have palpitations and chest pain. And then some people mentioned, well, quite frequently, they talked about fatigue and shortness of breath. So laymen believe that valvulopathies cause these kinds of symptoms. Okay, causes. So I think this is the heart of the data. So the causes of valvulopathies, in fact, they are rheumatic fever and infections in the throat when we're talking about childhood and teenager. And this is only quoted by or mentioned by a small portion of the participants. We also have the opportunity of talking to them and explaining to them about the causes that are preventable in terms of valvulopathies. And consequences, what are they? What do you imagine? What do laymen believe are consequences of valvulopathies? More than half believe that valvulopathies can cause a heart attack or a heart failure. That's very interesting because laymen that were in the research, they attribute very serious consequences like heart attacks or heart failure, or consequences that are very moderate, like difficulty to do sports, difficulty to carry out your daily activities. So we're going to two extremes, and we understand that there is still the opportunity of improving communication about the consequences of valvulopathies. Laymen, they also think that echocardiograms and electrocardiograms are the methodologies used or the techniques used for the diagnosis of valvulopathies. And auscultation of the heart, cardiac auscultation, is sufficient for the detection of valvulopathies. And this is in third place in the list. It is mentioned quite a bit, but it is possible that laymen understand that it's more difficult to detect valvulopathies more than they think. What about treatment? So this is really interesting. Treatment that they believe is used or is adequate for valvulopathies are prevention and medication. So it's monitoring of heart activity, healthy diets, not smoking, and avoid intense physical effort or some kind of medication. So very low on the list, less than 1/3 of Latin Americans believe that it is a case for surgery. And it could be a non-invasive or minimally invasive procedure or even a heart transplantation. They believe that prevention and medication are ways of doing this sort of treatment for valvulopathies. So there's still a lot of effort we must do in terms of communication. We have the opportunity of doing this in several points when we talk about causes and when we talk about treatment for valvulopathies as well. Changing the subject a little bit, what happens to the patients that have valvulopathies? So in the sample, we had a small portion of people diagnosed with cardiopathies, and 2/3 of the sample do not have cardiopathies. So they are not close to the disease or the diseases. And 14% do not know. They don't know if they have cardiopathies or not. They are not monitoring it. They have no knowledge. They have no previous diagnosis of some problem with the heart. And of those who have it, which is 11% of the participants, they diagnose specifically within the group of cardiopathies. Most of them had arrhythmia, so it's more than one possibility, murmurs, and valvulopathies in 15% of the cases. So there's still atherosclerosis and congenital cardiopathy and also arrhythmia. Well, arrhythmia is most of the cases of this small sample of those participants that have been diagnosed with cardiopathies. And highlighting valvulopathies. So we are moving into the quantity of people who were participating, the 11% that presented cardiopathies, and out of these patients who had cardiopathies, 15% that we saw that they know they have valvulopathies that have been diagnosed. What are the causes? So now we're limiting the number of participants to only the patients that have valvulopathies so they can tell us the cause of the valvulopathies that are congenital, most of them. Some are related to aging, about 1/3 of the patients with valvulopathies, and endocarditis is the third possibility of known causes of valvulopathies of the participants who reported prior diagnosis of valvulopathies. So what happens with these patients? Do they have any consequences in their lives, in their daily lives? Yes, most of them. In Brazil, about 2/3, in Mexico, about half, and actually exactly half. They felt in the last 12 months pain, chest pain and fatigue, and it limited their daily activities. So over here, we're already bringing the experience of patients that have valvulopathies. And then highlighting the numbers. And then we go back to talking to, well, now that we've already taken the patients that have valvulopathies, we go back to talking to all of them, the total number of people in the sample, to monitor and to ask them about their habits in visiting cardiologists. And about half of the participants of the complete sample, regardless of the country, it was half of them who went to the cardiologist or the GP in the last 12 months. So that's good news. And this number is a little higher when these patients have access to healthcare plans, a little smaller when they depend on the public healthcare system. And then highlighting the numbers. What if we asked them separately, if we looked at, because these are according to the age. So people who are above 60 years of age, they went to the doctor more frequently, cardiologist or a GP, and compared to people below this age. And they had a similar, or they had auscultation done on their hearts in the consultation with a cardiologist. That's also good news. And to conclude, the consultation, the medical consultation with the cardiologist or with the GP includes auscultation in about 60 or 70, 76% of the cases. So that's also very good news. And the frequency is higher when the doctor is from the healthcare plan compared to the public service, but the heart is being monitored in most of the population. So the news, or the idea, is that cardiopathies call the attention of the Latin American public, and we are only behind cancer that takes the attention of the media. It is an opportunity to to ride this wave of awareness and use it to talk about valvulopathies, explain them, inspire care for the heart, and also teach about taking care of your heart from childhood on. Thank you. That's it. Wow, that is fantastic, Roberta. Congratulations. And congratulations for the research and for everything that you provoked in terms of the numbers. And congratulations on being so didactic. Your presentation is fantastic because you have the tone of explaining numbers. Numbers are not always easy for us to follow, right? For laymen, for people who are not familiar with the numbers. And I usually say that numbers, they are only numbers in maths. In healthcare, in research like this, numbers are people. We're talking about lives. We're talking about, mothers, fathers, dear ones. So congratulations on your didactic as well on presenting the research. So as laymen, some things really called my attention. The first one is something that has to do with us Brazilians, because from what you showed, this is not about the other countries, but we do not associate aging to having to go to the doctor. And we're going into a debate and we're going to go deeper into these issues. And something else that called my attention was that when you said that people do not associate aging to looking for the doctor, and we know this, we know the impact that this has and what it can do to people's health. I'm just going to make a comment here. When you talk about aging, and at the same time, Brazilians say that they're not worried, but when they feel older than they really are, so aging is not a reason to go to the doctor. But when he feels older than he really is, then he goes. So, it's a little controversial here, but we're going to go into the details with Neil and Carlos and the doctor. And there's also more data that you talked about. And Dr. Auristela, I'm going to ask her afterwards about this, the question that I'd like. So when do you run to the doctor? And I remembered when I saw this slide, I remembered something that Carlos Castro talked about here at an event last year. I never forget, Carlos, something that you said, and it stayed in my mind, which is follow your heart. Follow your heart in the sense that if you notice that there's something different in your heart, look for the doctor. We cannot, I remember what you said, and it really made me think about our heart. We can't leave it for later. So we know, everybody knows, with a rushing around in your life, and he said, I have to go to the doctor, and you take a long time to go. So this question I thought was very pertinent, and it's great because we're going to be able to debate it. So let's start our debate round, and we're going to discuss the research. And we're going to start with you, Neil.
Eventos anteriores. Neil, queria começar.
So, Neil, I wanted to start this round of questions asking you about why it's important for the Global Heart Hub to work with initiatives like this one. So doing local research and regional research. And then going on to the next question, in your opinion, what are the most relevant discoveries in the presentation we just saw now compared to other research that you did globally, you have done globally? And I'm going to ask the questions for you to include in your answer. I would also like to ask you about data that we saw that Roberta presented, that half of the interviewees in the region said they had heard about valvulopathies, but they didn't really know what they were. So over to you, Neil.
So firstly, can I say hello to the faces I'm familiar with, Fernanda and Carlos, and say greetings from Ireland. I'm sitting looking out at sunshine for 3 days in a row, so our summer must have arrived. At least it's not raining. Can I say that I'm absolutely delighted on behalf of the Global Heart Hub to be part of this discussion, to be part of this project. Both Lado and Paco are very valued affiliates from our network of patient organizations across the world. And can I start by congratulating everybody on this very important piece of work? And it's very interesting because at one level, it confirms pretty much what we see here on the other side of the world, if you will, certainly in mainland Europe, that by and large, there is very low levels of public awareness of the signs and symptoms of valve disease. There are some interesting differences between what you have found in your survey and what, of course, we know from our data here. And I guess one of the big differences is the prevalence of rheumatic fever in your region, which is something that is quite uncommon in Europe. And we know that rheumatic fever is in fact a very significant contributor to valve disease. So when I'm looking at the data that was presented, the number of people, or percentage of people in Latin America who really don't know what valve disease is, something of the order of 3/4 of the survey sample. That equates very similarly to our European survey, where in fact it was higher at 95%. Interestingly, as expected, when you look at what people fear most in terms of health issues, cancer came out on top in your survey, and equally so in Europe. Now, why that's significant, I think, is that particularly when you're talking about vascular disease, valvular disease, aortic stenosis, for example, which is the most severe form of valve disease, actually undetected and untreated would have a worse prognosis than most cancers. So in actual fact, if you were to be concerned about underdetection of a condition and under treatment, aortic stenosis would be one of those conditions that you could be concerned with. In Europe, we found it interesting that one of the first steps in detecting valvular heart disease is the stethoscope examination. And there's quite a variance across Europe in the frequency of use in primary care of the stethoscope. In fact, ranging from as little as 1/3 of patients reporting a doctor using a stethoscope on a visit, right up to in France and Belgium, high numbers like you have reported. And I was trying to figure out, why is it that there's such a high use of stethoscope in your region? And I was actually speaking to somebody this morning from Latin America who I think put a spotlight on that. And that, of course, is that in your region, there are perhaps more reasons for a doctor to use a stethoscope, reasons beyond valve disease. And so the question there is, when those doctors are using stethoscopes, are they actually looking for valve disease? And that's something that I guess the research needs to dig a little bit deeper into. But overall, I think what's important from this data is that we know that general population awareness of valve disease across the world is low. We know that there is an urgent need to highlight that certain forms of valve disease can be serious. In fact, valve disease in general is quite common, certainly over the age of 70. In fact, we say it's common, serious, but treatable. And the treatable piece is the good news piece here. And there are procedures now, newer, more advanced procedures, which allow valve repair and treatment, in some cases, minimally invasively. And so it was quite interesting, again, on the awareness levels, that in the population that was surveyed, there was not an awareness, I guess, of these newer treatments, because the survey respondents seem to focus on medication more than intervention. Maybe that's enough to say at this point, and happy to contribute further as the discussion continues.
Muito obrigada, Neil, pelas suas colocações.
Thank you very much, Neil, for your comments, and now I'm going to bring the debate over to the studio. And I would like to ask you, Dr. Auristela, could you tell us what kind of discoveries were the most interesting, in your opinion, in this research? And you are very close to the career, right? Sometimes you don't have contact with the patient, but according to your curriculum, you maintain a very close contact with patients, and especially in public health here in Brazil, and there are so many challenges. So I would like to understand what you thought was interesting, and if the data was a surprise, or does that definitely prove what you already see in your daily practice? Well, first of all, I would like to thank you very much for the invitation, the two invitations to be part of the committee. It's an honor, and I dedicate myself to valvulopathies, and I've done that my whole career. And I think that it is past the time of talking more about this subject. So it's a great pleasure to be here with you. So the research, I thought, brought very valuable data, and it's an excellent way to know any sort of happening, and in the case of diseases, knowing what the population knows about it. So as we talk about the disease, we automatically teach them how to prevent it and the consequences that diseases will bring. So, what happened with COVID now? You don't have anybody in the planet who has not heard of COVID, right? And doesn't know how to prevent it. Maybe they don't want to prevent it, but they all know. They were all aware. They became aware of how to prevent it. So in valvulopathies, I think it's very important. And the campaigns in terms of cardiovascular disease, they are reasonable. They could be bigger. So what called my attention was that cardiovascular diseases are in second place behind malignant tumors. So campaigns for cardiovascular disease, they have advanced. But considering cardiovascular diseases, people are a lot more connected with angina and infarctum, not with valvulopathies, right? They don't even know the word. Even people who already have valvulopathies, in my experience, and people who have been operated many times, they don't know why they got that disease. So I think it's a very important study, and I brought some data from Brazil. So in Brazil today, we have about 30,000 new cases of acute rheumatic fever in Brazil, and 2/3 of cardiac surgeries in Brazil are to treat valvulopathies. So it's a very high number, and I expected the population to pay more attention to that, to be more aware of that. But I would highlight three important pieces of data. So for me, since we're talking about a database, as you said, there is a database of people who answer the questions. So probably this group has higher schooling levels, right? So higher education levels. So this is not the educational level in Brazil. So this is a more privileged group of people. 76%, they have complete high school up to university, and also 92% are inserted in the working in the labor market, which makes it even more interesting because although they have a certain level of education and they work, valvulopathies are in 8th place. It appears in 8th place in 10 diseases. And even after Alzheimer's, because the population had 39% of knowledge, they should not be worried. They're 39 years old. They should not be worried about Alzheimer's yet. And valvulopathies come in later after that. And only 4% of the people interviewed, they make a correlation between rheumatic fever and valvular disease. So it really shows that we have a lot of room for campaigns in workspaces and also at schools, especially at school, elementary school. where amygdalitis and rheumatic fever affect lots of young people in school. And even the patients who have valvulopathies, 16% talked about rheumatic fever as a cause. And most of them think that they were born like that. Maybe there are congenital valvulopathies, but it's definitely much more rare than rheumatic valvulopathy. Rheumatic valvulopathy is not a rare disease. It is endemic in many countries, and Latin America has contributed a lot to these patients. And something else that called my attention is that 63% of those who were interviewed are in the South and Southeast. So maybe there's a bias there, a negative bias in the example of rheumatic valvulopathy in this region of the country. It's not very common. And I would also like to remind you that 2/3 of the patients, that I thought was very interesting, they had infection, sore throats, repeated sore throats. I'm happy because most of them were treated with antibiotics. But what called my attention is that in Argentina and Brazil and Colombia, the incidence of treatment with injectable antibiotics was smaller. It was 30%, so 1/3 of the patients. In Mexico, it was much bigger. So half of the patients were treated with injectable antibiotics. That would probably be, that's very important because we know that if you have a campaign to treat bacterial tonsillitis or streptococcal tonsillitis with a single dose of antibiotics, the effectiveness of the treatment is much higher. So the countries that eradicated rheumatic fever, they had this campaign. I think it's very low. It's a very low rate of treatment with benzetacil in Brazil. Except Mexico probably has a better campaign about this. And we know that adherence to the treatment, oral antibiotics that you have to take for 7 or 10 days, in childhood or when they're teenagers, it's low. If you can treat them, although it is very painful. We know that benzetacil is very painful, but it's a single dose and you guarantee the treatment. So campaigns about this are welcome. And I don't know about other countries, but in Brazil, there is difficulty in using that. Sometimes it's not in the market and you have to go to the emergency to get it. And these are my first comments about the main findings in general. So thank you, Dr. Auristela. It's always a pleasure to hear you and your comments. And it's very important when you reinforce this point that research happens in a group of people that have a higher educational level, and it shows how necessary it is to make campaigns, national campaigns. And our population here in Brazil have very little perception about the correlation there can be between tonsillitis and valvulopathy. And tonsillitis is treated as something, small and something that people don't really know in depth. They don't know what tonsillitis can cause in the future. So thank you very much. And we're going to continue our round of comments. And now I would like to take the debate to Mexico. So Carlos Castro, thank you very much for being with us once again. We would like to hear your perspective about the results of the research in Mexico. What are the most interesting findings in your opinion? And if they were a surprise for you? Well, first of all, thank you very much. Thank you very much for two things. First of all, for including us in the study, and in second place, for being here with you. I already feel I am part of Lado. I feel I'm part of Brazil. Why? Because we have lots of similarities in terms of our patients and how we treat diseases. So what can I say about the findings? Well, the most important thing in the findings was that, first of all, there is systematized information, organized information about the cardiovascular diseases, about valvulopathy, but above all, about the reactions of the patients when we talk about their feelings or their decisions of getting treatment. So for me, this is the most relevant point. And it's knowing that we can have this piece of information. This is what excites us. It really makes us excited because then we can reorganize or restructure our working programs so that we will be able to generate this sensitization, and not only in the population, but also in terms of decision makers. The decision makers, they have to be very aware, and they can't say no anymore because we are going to produce this evidence. And with all of these findings, and for me, the most interesting and the most important thing, with all of this information, we have the great responsibility of teaching it and having greater penetration in the population in general. So I believe that, and also something that called my attention, I believe that it was 39 years of age in this sample. And as the doctor said, in terms of valvulopathies, they appear in a more advanced age. I believe that with this, we can accelerate the diagnosis of the treatment of the valvulopathies. The world of medicine has evolved a lot, and the treatments for cardiovascular diseases, they are also moving forward. And they are the number one cause of death in Mexico and around the world. And we do not have the levels of awareness that cancer has. So these are the challenges, the results for us, and we have to use them as challenges, and challenges, that is what we should have this in the basis. Thank you, Carlos. And now I would like to go from Mexico back to Ireland. So Neil, I would like to ask you something that is, research has shown that endocarditis with 30% and infarctum with 20%, they were mentioned by Latin Americans as the causes of valvulopathies. And aging had 6%, right, Roberta? 6% of the answers, and rheumatic fever was 3%. So in your opinion, why do you think that they relate to these causes? And what is your suggestion with all of the experience that you have at the Global Heart Hub to inform people better about the causes and risk factors of valvulopathies?
So I think building on what has already been said, when you look at the age profile of the respondents to this survey, I think 2/3 are under the age of 45. So ordinarily, that's not a group of people who would be necessarily concerned about their cardiovascular health. That's unfortunately our experience this side of the world, but certainly you might expect them not to be as well informed about valvular heart disease, with the exception that they're living in an environment where one of the significant causes of valve disease is rheumatic fever, and you have such a high prevalence of rheumatic fever. I think the fact that endocarditis and heart attacks are called out would suggest that there is some level of general awareness of these conditions as cardiovascular conditions, but it would suggest to me that, confirm, I guess, that really the population is not aware of what the causes of valve disease are, or indeed are aware of what valve disease is itself. We know that typically valve disease is largely a condition of aging, with the exception of conditions like infection to the valve or congenital problems, with that one big exception being rheumatic fever. So a big a big, I suppose, insight from this survey is you have a population who are living with a high prevalence of rheumatic fever, and from a public health and cardiovascular health perspective, there is clear need to instill in people the importance of being treated for rheumatic fever, and the importance of monitoring these individuals who have rheumatic fever in the context of a likely progression to valve disease. And I think what Dr. Ramos pointed out is also very significant when you consider that the population that were surveyed are largely an educated group, people who potentially have had access to education. And if they're not a representative sample, then you'd even be more concerned about those who have lower levels of education, lower levels of understanding, and lower levels of awareness. So there's a real value to this data in bringing it to the civil society groups like Lado or your statutory agencies to really look at this link between rheumatic fever and valve disease and disease awareness in that regard.
Obrigada, Neil.
Thank you, Neil. And with regard to the specific data from Mexico, and taking the question to Carlos Castro, the research showed that 58% of Mexicans are concerned with cardiovascular diseases, and 59% classified diabetes as a concern, 42% are worried about strokes, but only 31% of Mexicans mentioned valvulopathies. So we would like to ask you your perspective on this result. Well, I think that, in fact, we don't have a level of information. So I don't want to use the word awareness. There is no information. It is not in the public sphere in general. It is not in the different levels, social levels in Mexico. We don't have this information. And I think this is what definitely affects it. We don't have this interest in valvulopathies. But above all, we have the other campaigns that are really very strong in terms of communication. And especially now, Mexico is bringing a policy, a very strong policy for treating overweight, the population, and there's a strong cause for cardiovascular diseases, a consequence in cardiovascular diseases. And so we need patients to have the information, even though if they have the information, even if it's not worth anything for them, but they need to be presented. This information needs to be presented in our public health system, and they need to have access so that patients will have access to a cardiologist, so that patients will have access to a diagnosis, and above all, a treatment. So when I saw the distribution of the population and the results, most of the people, they have to do with private institutions. So private healthcare institutions are much more advanced compared to the ones present in the public health system. So we really have to make a big effort for the public healthcare system that addresses the poor population, that serves the population that has a lower socioeconomic level, so that they can also have the opportunity of dealing with these patients that can be on the way to a disease, to a valvulopathy. So I believe that we have to work very strongly on the decision makers and the healthcare institutes and our government, so that we can strengthen the diagnostic programs and also the treatment of valvulopathies. Information can get there in 1,000 different ways, but if you don't address this properly, we're going to be very frustrated, and this is also going to affect the mortality rates. Thank you, Carlos. And now talking a little bit about Brazil. Brazil was the only country where they answered that point about aging, that aging is not a reason for you to go to the doctor. So I would like to bring Dr. Auristela back. So why do you think, so you work with these patients in practice, why do you think they have this outlook? Well, we have, can you please use the microphone? Yes, sorry. Yes, so with the average age of the patients, they were young, right? 39 years of age. I think that Brazilians, they are not very, they're not educated to be able to prevent this when they get to a more advanced age. So they work more in terms of immediate things. So Brazilians are, they think more about the present, their lives now, if they're healthy now, and they have vanity, very high vanity. And this was accentuated, and they only go to the doctor when they're sick, as we saw in the research. When they feel they are older than they really are, when they feel fatigued, then they go to the doctor. But as prevention, unfortunately, although there are several campaigns that Brazil has already done in terms of prevention, Brazilians still think about their lives today and how they are dealing with. So if they are okay, they continue in that way. So I think we still need many campaigns to be able to have Brazilians who are aging. And it is a young population, although there is an aging population, but the population has been growing. And as Neil said very well, in Europe, for example, stenotic aortic stenosis is much more prevalent, and we can see the mitral calcification and aortic calcification that's also present here in Brazil. And the risk factors for degenerative or calcified valvulopathy is the same causes as coronopathies. So smoking, sedentary lifestyle, diabetes, dyslipidemia, but when they talk about these risk factors, they only think about diseases like angina and heart attacks. They don't think about valvulopathies. So, you can acquire both diseases, coronary heart disease and valvulopathies, right? So the population needs to understand that prevention is everything. So to be able to age with health. So aging with health is extremely important for citizens and also for the healthcare system. Yes, and we see the aging of the population as a whole around the world, and we always have to reinforce this issue that, this has always been the case, but increasingly, if we are living longer, the aging has to have more health, has to be healthier. So thank you for reinforcing this. And just another comment about what is more or less obvious about the profile of us Brazilians. In Brazil, I don't know about Mexico and Europe, there is a prejudice in terms of geriatricians. So if I should go to a geriatrician, they say, no, I'm not going there, because they always want to be young. And they prefer to go to the cardiologist. And when they talk about geriatricians, they think, oh, no, that's for old people. It's not for them yet. Yes, that's a very nice comment. So, Neil, we would like to hear from you. I have another question. So 58% of Latins said that cardiac failure is a consequence of valvulopathies, which is correct. But considering the answer about the causes, do you think that the people in our area here, do they pay more attention to the consequences of disease instead of the cause?
Yes, I thought that statistic was quite interesting given the general lack of awareness that 58% of the population would uh, correctly associate heart failure with heart valve disease. And I suspect that, as is the case in many countries, heart failure, heart attack, cardiac arrest, they're all terms that the general public just associate with cardiovascular disease. And it's probably just a coincidence that they've got the right answer here in terms of a relationship. I think the important piece here is to your question about consequence rather than cause. In general, I think in the world across the world, we know cardiovascular disease is actually our biggest public health challenge, and to some extent, we have accepted a certain level of complacency about this across the world, as in it's almost like an inevitable part of the aging process, which is something that we really need to change. So there really needs to be something of a paradigm shift in terms of our thinking, because we know that healthcare systems across the world are crumbling under the burden of all cardiovascular diseases. And we know that up to 80% of cardiovascular diseases are largely preventable. So we really need to, and I say we as societies need to really put a spotlight on a condition that has a significant proportion of preventability. And we need to encourage the concept of earlier detection, earlier diagnosis, earlier awareness of signs and symptoms. And at the other end of the scale, the notion of healthy and positive aging. And there's a lot to that. There's a lot of cultural stereotypes that have been shared here already. But if we do work together, I do believe we can change that paradigm shift to a more preventive rather than reactive healthcare system.
Com certeza. Obrigada, Neil. Trazendo agora o foco.
Definitely. Thank you, Neil. And now bringing the focus to the part about Brazil. Dr. Auristela, I'm going to talk about some data that Roberta talked about. So here in Brazil, 64% of the participants in the research talked about periodic follow-up with a cardiologist or with a GP. This is treatment for valvulopathies. And then 60% of the people said that treatment would be to have a healthy diet. So only 36% mentioned the implants of valves with minimally invasive systems, and 33% only talked about heart surgery, so open heart surgery. So these are treatments. So in your opinion, so we have a visible confusion between treatment and prevention. What do you think? Yes. So this data I thought it was very interesting, and I'd like to highlight at least 2 points. The first one is that treatment, not treatment itself, but follow-up, 64%. They mentioned that periodic follow-up is in this periodic organization that they are able to see how severe the lesion is. But many of them have a very discrete lesion, so you can follow up and you can, this is the time for you to encourage the patient to take care of himself and to prevent rheumatic fever, take care of oral health, and look at the severeness of the lesion and follow up. So definitely follow up with a cardiologist if you have some suspicion of a valvulopathy or if you had an episode of rheumatic fever. Even if you if you haven't had any auscultation, then this case should be monitored for a while. So I was happy to hear that they think that they need to go to the cardiologist. On the other hand, they think that they talk very little about cardiac surgery. And this shows how they don't understand the severity of the problem. So most of the patients with valvulopathies, either due to rheumatic fever, or if it's degenerative or there's calcification involved, they will need cardiac surgery at some point in their lives. And heart surgery is still treatment number one. Conventional heart surgery, open heart surgery, it is still the first option for treatment in these patients that are 39 years old. And on the other hand, one third of them already talk about treatments that are minimally invasive. So an implant of the transcatheter prosthesis. So, look at how information is important. They're hearing about it, right? It's new therapy, and we've been talking about it in the media. So they know they have this sort of treatment, but they don't know. What they don't know is that most cases are still, they still use surgery. So 2/3 of cardiac surgeries are due to valvular diseases in Brazil. So imagine the cost to society as well as to the individual and also the healthcare system. So many of them are reoperated because in general they change the prosthesis. Prostheses do not last your whole life, so they need another operation throughout their lives. So I was very happy about that on the one hand, but on the other hand, I noticed that they still think that it's not such a severe disease, and it can be very severe. Thank you. Thank you, Dr. Auristela. With regard to Mexico, Carlos, amongst the interviewees in Mexico, only 50%, more or less, said that in people who are above 45, they should go to the cardiologist or GP every 6 months or every year to monitor their hearts. And only 44% mentioned that they have already gone to the doctor at least 1 year ago. So, or less than a year ago. So what do you and what does the Ministry of Health and what can PACO, your institution, do so that we can increase this number in the next research? Well, in fact, I think that according to the outcomes that we have now, we have to get to them more immediately. We have to get to the decision makers and the hospitals, the cardiology hospitals in our countries, and we have to get to them because over here we can clearly see the process. We see the process that we need to establish from prevention, and I agree with what Neil said and what the doctor said, that we have to prevent more. We already know many of the elements for prevention. Many of the elements are exercises that are not even medical. It's about nutrition, so healthy life habits. So this could be the start, definitely, in terms of the social determinants we have. It's very difficult to be able to implement this in the great nuclei of population that we have. And what happens is that right now we are immersed so that the authorities can establish prevention plans. We have seen this, that in the Mexican Institute of Social Security, which is the greatest provider of healthcare in our country, 65% of our population, they are members of this institution, and they have started this program called Prevent. So before any kind of medical consultation, they have to go and see a GP so that they will make a general report of the medical situation, and this could be the beginning of an earlier detection of these cardiovascular diseases. And of course, when we talk about the cardiologists that have some sort of some sign, if they see some sign of the disease, because we know that there can be access to other types of treatment. As the doctor said, the heart surgery, open heart surgery, is still the most common practice. But still, in private medicine, we are taking into account that there is this procedure, there are non-invasive procedures, and the people who have health plans, they are being treated in this way. So we also have to make a transition So these new technologies should get to the public health institutes. So we have to believe that the consultation with the GPs is very important. For me, this is even more important. Why? Because this is the first step. We also have to educate the GPs so that they can also be able to treat or to find through the stethoscope some sort of cardiovascular disease, and especially the valvulopathies. So I believe that the Mexicans need to have more access to cardiologists. They must consult cardiologists. We see that the economically active population, the strong population in our country, this is a common practice to go to the cardiologist. And only the people that work with the public health systems, they have to refer these patients. And this is not happening. And this is the work that we have ahead of us so that Mexicans will have not only go to the consultation, but they will come out of the consultation to another doctor. Thank you very much, Carlos. And for all those who are with us, we are now going into the last part of our debate. We have another 10 minutes to finish. So we had a lot more questions for all of you, but because of the time, we are going to put the network of Lado. We're going to open them for people who want to send questions. But I'd like to have a last round of comments, starting with you, Roberta. What would you like to leave as a highlight or important things for us to strengthen in our communication? So this debate was very interesting. The comments from all the doctors were brilliant. Brilliant. Definitely, I learned a lot in these last 2 hours. Once again, I think that, as has already been mentioned here, cardiovascular diseases are costly for the system. They are costly for the public in general, the individuals, and it's great to have some kind of attention given to cardiovascular diseases. And that is related to personal care with healthy habits. And it is an interesting starting point to evolve towards specificities like valvulopathies. Great. Thank you very much, Roberta. Thank you for your participation, for being here with us. Dr. Auristela, please, your final comments. Yes, I would also like to thank you very much. I thought the meeting today was very interesting, very nice, and we already knew that valvulopathies are not very known diseases in the population in Brazil and in Latin America. And I think that in a country that has an endemic disease like this one, it is very sad. So it is worth taking advantage of the data and transform them into evidence, into actions. So show the data to the competent organs, the qualified organs and doctors, and definitely encourage the population to look for treatment if necessary, providing an opportunity for everyone to have the diagnosis. I think we have to emphasize, especially the pediatricians and the GPs, as has already been mentioned, healthcare professionals, not only if the patient already has some kind of auscultation or a murmur or some valvulopathy, but somebody who lives in an endemic region for rheumatic fever. So the data was very interesting and it was great to participate. Thank you very much for everything. Thank you very much. And Carlos, we would like to hear you too. Thank you very much for your participation.
Thank you all. I think that the first thing that I can make as a final comment is networking is a very important thing that we should do. It accelerates the process of our inner knowledge, and it's also accelerate how to structure new actions. So I am also very glad that Neil was here, because he, as a part of the Global Heart Hub, is doing great efforts in this networking and putting together organizations around the world on which we can share best practices. I feel that this is, to me, besides all the medical information that we have and the results that now we have the responsibility to disseminate, I think, to me, the best conclusion is how important it is to unite, to do networking, to do a better representation through this sharing of practices with our patients and with our local community. I think this helps us, and it reinforces the passion that we must have. We have the responsibility to represent patients, and in this case, cardiovascular patients. Thank you.
Muchas gracias, Carlos.
Thank you very much, Carlos. How about you, Fernanda, on behalf of the fantastic work you do, the work in this event and international relations that are so important? Like Carlos Castro said, he's talked about the importance of networking and international networking. What are your final comments? Well, once again, it is very exciting as a representative of the Institute to know that we can promote these meetings. And here in my notes, what I put in first place is that it's important to know this is only a small part of what the very complete research did. Guto is going to give you some good news at the end, everybody who is listening here. For me, as a representative of the Lado Institute, it shows that it is possible to work in a network when we join forces of organized civil society, just like we are, Lado, Global Heart Hub, and PACO, plus healthcare professionals like Dr. Auristela, representing this group here, and also the support of the industry, because all of this happened because we had support from the industry to help us to do the research and having qualified professionals. So we don't do monkey surveys, right? So surveys that are not based on people to help us. That is very important in Lado Institute, in the Global Heart Hub, and in PACO, so that we can get to good outcomes. When these individual interests are set aside and are overcome, so that citizens and patients can actually be in the center. Because we talk a lot about patient-centered care, but what does that mean? So that's very important for us. And also in the region, in Latin America as a whole, and then we're going to take this further to Argentina and Colombia, we have to work very intensely on two factors: aging of the population. So Brazil is going to be the fifth oldest nation in 2030, the people who are here, right? And we also have rheumatic fever, right, doctor? So we have two curves, two huge curves that we have to face. And the second point that Carlos and the doctor said, the research, the studies, they can not only offer information, because information many times is only for, coming out in a newspaper or being talked about on the radio. But for us, as an organized civil society, these outcomes must become the basis for us to be able to act and to do something positive with the information, so that we can influence, so that we can reinforce what is doing well, and so that we can help to change what is necessary in terms of public policy decisions in Brazil and Latin America and around the world. So for us, it's always very important to do this sort of work, joining efforts. Congratulations. And as a representative of a civil society, I always congratulate you on the work of advocacy that you do, using these tools so well, communication tools so well. And to conclude our debate here, our final comments, please, Neil, have your comments too. We would like to have them.
Yes, and I know time is against us. Firstly, again, just to restate my thanks and congratulations to Lado and Paco. Today's event, the research, is really an exemplar of what the whole Global Heart Hub initiative is about. Both Fernanda and Carlos have been part of an international discussion in valve disease, and they've taken the initiative from that to go back to their respective countries to get real world data and gain insights, which we in the global community greatly benefit from hearing and sharing. Today, to me, the big standout message here, and if I'm correct in what I picked up, that something of the order of 2/3 of cardiac surgeries in Brazil or Latin America are valvular disease, would suggest to me that that is clearly disproportionate to other parts of the world, and therefore there is a serious almost epidemic, if you like, of valvular heart disease, which is unknown by the wider community, and particularly the two key drivers that have been called out in this discussion are rheumatic fever and aging. And so I think the discussion today will definitely contribute locally and regionally to impressing on policymakers and decision makers around the importance of educating and sensitizing the population to these important issues, that rheumatic fever is correlated with valve disease, and that so also is aging. And there are so many things we can do to reduce the burden of these. So finally, thank you again. I'm really privileged to work with such passionate advocates as Fernanda and Carlos, and it's fantastic to have them in this international community, and together we're stronger. So I think as we continue to work together, we can have the voice of the community heard loud and clearly. Thank you.
Muito obrigada, Neil. Como você acabou de ressaltar,
Thank you very much, Neil. As you just said, it's very, well, I'm even excited to see the action of the efforts. You know, we're getting Neil from Global Heart Hub in Ireland. So these are visions of different countries and continents. We have Carlos Castro from Mexico. You are here in the studio. Thank you very much, Fernanda, Roberta, Dr. Auristela. Thank you to all of you who are watching us on behalf of Lado pela Vida Institute. Thank you for your participation. Thank you for your attention. And there's always a lot of learning. And I would like to highlight, before we end, this important partnership from Paco and Global Heart Hub for the research. And also on behalf of Lado Institute, we would like to thank Edwards Life Sciences for supporting the research. And before we conclude, the surprise that Fernanda promised, I have some great news for everyone who is watching. Lado has produced an ebook. You're going to have access to a digital version. This is here in my hands. I have this hard copy with all of the discoveries of the research. So in Portuguese and English and in Spanish. The content, the information will be available if you request them starting on the 6th of June. So social media, the Lado Institute, also the ones of the campaign Follow Your Heart. It's a specific campaign that Lao does, as we call the Lado Institute, Lao, and also the social media from Paco and from Global Heart Hub. They will tell you how to acquire the information and get this ebook, everything that we debated here today. So for those who are watching us, thank you very much for your attention, for your will and intention to learn more and have more information to share in this joining of efforts, so that people's health will be, as you always say, Fernanda, so that health of the patient will be in first place. Thank you, everyone, and see you next time.